Hi everyone, and thank you for joining us for this webinar on advocacy for global spine health. My name is Eric Muehlbauer. I'm the CEO of North American Spine Society. And this SPINE20 webinar was put together because we realized that physicians are busy people. They've got great training when it comes to medicine. And though they're involved often in advocacy, they probably don't have a lot of training or insights into how that really works. So the leadership of SPINE20 thought it would be really important for us to put together a panel of experts to help you be more effective locally when you're trying to take the policy recommendations from the SPINE20 effort and get them implemented locally in your institutions or in your governments, wherever you may be. So the key for us is to align on the importance of advocacy and how it's carried out by civil society and professional organizations like medical societies. So the goal here is to increase your understanding of how to participate in and help shape public policy development. We will talk about the specific role of medical societies and medical society leadership and other partnerships that are important in policy shaping. And we'll talk really about the importance of effective communication. And that really is the key when you're going to be doing any kind of lobbying or advocacy within the health field. So the workshop agenda, we'll talk about the objectives and the agenda. After the welcome introductions, we'll talk about advocacy, all the different channels that advocacy takes, who are the different stakeholders, and why it's important to know their perspectives. We'll talk again about the role of medical societies in advocacy. We'll talk about how to actually influence public policy. And again, we'll talk about the importance of effective communication. And then at the end, we'll do an evaluation. We'll have some closing remarks and Q&A. Okay, as we get moving along, first I want to say a special thanks to Medtronic for all their support for SPINE20 over the last 3 years. Especially Renato Amarin, Ashley Owen, and Karen Gunawarden have all been very supportive of the SPINE20 effort. In fact, they gave us access to some of the experts you're going to hear from today. So who are you going to hear from today? So the first is Ed Doring, who is past president of NASS. He's actually got experience working on Capitol Hill before he went into medicine. Phil Schneider is on the NASS board. He is the chairman of our Advocacy Council, also president of National Association of Spine Specialists. And he's in the DC area. He's got a lot of experience working on Capitol Hill, trying to affect change. Then we're going to hear from Ana Rita Gonzalez, who is the president of Policy Wisdom, LLC. She's got a lot of experience globally in trying to affect healthcare policy. And then Stephanie Kundert is the last speaker, and she's going to talk about her experience with the stroke field and the lessons learned there that really might apply to spine. All right, so first up, we're going to hear from Dr. Ed Doring, who graduated from Dartmouth College and the Yale Medical School, and he's the founder of the Spine Institute of Arizona. He's been voted by his peers as one of the top docs in Phoenix. He's also passionate about teaching and medical legal work. He's also traveled internationally to volunteer his surgical skills in many third world countries. He is a mountain climber. And he is currently the past president of the board of directors of NASS. And it was really his idea that SPINE20 start trying to teach doctors how to advocate for policy issues, because as he's experienced, doctors have a lot of training on the medical side of things, but really don't know as much about how to become a lobbyist. So SPINE20's webinar on advocacy is really the brainchild of Ed Doring, who will be our first speaker.
Hello, my name is Ed Doring, and I was president of the North American Spine Society last year. I've been involved with health policy advocacy in the United States for many years, of the type that is being described by Dr. Phil Schneider today. I've also been part of SPINE20 since its inception, and we have accomplished many great things, including our annual symposium and our multiple European Spine Journal publications. SPINE20 was established as a special type of medical society, one that is very different from most other societies. It was established not primarily for professional education, but rather specifically to impact healthcare policy internationally, amongst not just the G20 nations, but indeed amongst all the world's nations. SPINE20 members are in a unique position to advocate for health policy as trusted experts in our field and as representatives of ethical, nonprofit medical societies. Now, SPINE20 needs to grow in its ability to advocate for our patients. In February, Pierre Cote introduced us to Valentina Pomato, who gave us a great talk on influencing global health policy. Today, we're going to expand on that talk and further learn from experts in the field of nations-wide advocacy. We will hear from these experts how medical societies can influence global health policy and about the barriers we must overcome to do so effectively. We have two speakers today, Stephanie Kunder of Direct Impact and Ana Rita Gonzalez of Policy Wisdom. Their bios will be shown to us in a minute, but I was most impressed that Ms. Kunder was successful in advocating for and in implementing nationwide emergency protocols for stroke patients. And I was also impressed with Ms. Gonzalez's involvement in international health policy, and specifically that she was named by CIO Views as one of 2022's 10 most disruptive women leaders. I am very much looking forward to their presentations, and I'm hopeful that we can all learn from them in advocating for our patients.
Thank you, Ed, for that very informative presentation. And again, thanks for your leadership on bringing advocacy to the SPINE20 group. So our next speaker is going to be Phil Schneider, who is an orthopedic spine surgeon in Chevy Chase, Maryland. He is vice president of the Centers for Advanced Orthopedics, which is the largest orthopedic practice in the United States. Dr. Schneider has been involved in research and teaching other spine surgeons. He's got over 60 major presentations and publications. He's been involved at the federal government level with spine care by serving as co-chair of Medicare's expert panel on spine fusions, and he has served in the American Medical Association House of Delegates. He is currently the president of the National Association of Spine Specialists, which is part of the North American Spine Society, which is he is the chairman of our Advocacy Council. And he has been a leader in advocacy, spine pack fundraising, and he's got a lot of experience on Capitol Hill. So I think you're going to learn a lot from Dr. Schneider today.
Hi, my name is Phil Schneider. I chair the Advocacy Committee and all the advocacy work for the North American Spine Society. Advocacy is very critical to the North American Spine Society. It's one of the three pillars of importance to our society, including research, education, and advocacy. Because of its importance in the North American Spine Society, my position serves on the board of directors of the North American Spine Society. What I'm going to talk about today is advocacy in the United States. I do not have any financial disclosures to talk about today related to this talk. In the United States, the healthcare dollars that fund us, to fund our patients' care and spine care, are really controlled by the Congress for the most part, the United States Congress. The United States Congress is made up of 535 members, 100 senators in the upper chamber, and 435 congressmen in the lower chamber. Now, these people, for the most part, have no idea about healthcare. They're not healthcare experts. Most are lawyers or business people, accountants, other people. Some are professional politicians, and they really don't understand the nuances of healthcare, especially spine care. Now, there are only about 19 physicians in the Congress. That's only about 3.5% of the entire Congress are physicians. Those folks do understand healthcare, but 97% of the Congress does not. So it's very important that we as physicians advocate for our patients to show them the importance of healthcare especially in our case, the importance of spine care. So our goal is to educate our members of Congress to show them the importance of healthcare spending, particularly when it comes to spine care, because most of the members of Congress have no idea about healthcare and spine care. And so what do? We meet in person with our members of Congress. We tell them about what we experience as a physician. We have our patients advocate to the members of Congress, directly or indirectly as well. Because remember, our patients are voters, and those are the ones that re-elect the members of Congress. So our members of Congress do listen to our patients. We have patient testimonials. We have stories of access to care they didn't get. We give them our expert opinion on spine care. We talk about new technologies. We talk about what's important. We talk about the challenges and the roadblocks to healthcare in the United States, because otherwise the members of Congress don't hear about it. So it's very critical that we do that. Now, unfortunately, physicians are not the only people who are talking to members of Congress, to the senators and the congressmen. Actually, most of the people that talk to them are not physicians, because they have their own vested interests in getting dollars from Congress. In fact, $720 million is spent every year for lobbying members of Congress. Physicians only spend 13% of that money. So 87% of all the lobbying expenditures in the United States are not done by physicians. They're done by other interests that we don't agree with. They may be done by hospitals that want money for something else. They may be done by nursing homes that want money. They are frequently, most often, done by groups like insurance companies that have a business interest or a for-profit interest for that. They're done by other organizations as well, pharmaceutical companies that want money for drugs that have nothing to do with spine care. So we have to be as loud as possible, because we are a small percentage of everybody who's advocating for health care. And we're actually the most important ones. We know what the patient wants. So once we start talking to our members of Congress, we have to also know, what do our members of the North American Spine Society want? What is the interest of our membership? We have 10,000 members in North American Spine Society. So what we do is we survey our members and we find out what's important to them and their patients. And we get a rank order of what's important, and we look at it and we figure out what's doable. Some people have crazy requests that are not possible. Most of our members have genuine requests that we can prioritize and do. So what we do is we do what we think our membership wants for our patients, our spine care patients. That could be more money for research. That could be changing regulatory policy that hinders our ability to care for our patients. That could be changing the way reimbursement occurs in order to keep doctors taking care of patients because of reimbursement issues. So all this stuff we do. Once we figure out what our membership wants, we then have to use that information to convey and advocate to members of Congress. We do that multiple ways. We do it through direct email. We do it through social media. We do it through phone calls to a member of Congress. We do it to having various campaign events. We call that grassroots campaigning. Within the advocacy group that I chair, we have a group called the Political Engagement Committee and the North American Spine Society Advocacy Network. And what that does is does grassroots outreach to our members of Congress. Our goal is to have a North American Spine Society member in every single district in the United States to talk to every single member of Congress. There are 435 congressional districts in the United States. Each have about 750,000 people, and we have a NASS member in each one communicate to their members of Congress. So that's how we get through to them. We also meet with them on Capitol Hill in Washington, D.C., in their offices. Now that COVID's done, we can go in person and meet with them. We meet with them, we meet with their staff. The staff is very important because their staff is the people that influence them on how to make decisions. Because again, the members of Congress are not experts in healthcare, but they all have staff members, one staff member that is an expert in healthcare that advises them. So we go through their staff members sometime if we can't speak directly to the members of Congress. Additionally, each member of Congress also goes back to their home district in whatever state, California, Texas, whatever in the country, and our members meet with them in their own home area, which has even greater impact. That's called in-district meetings. And we also frequently will have an event where we invite them to. We have all our North American Spine Society members attend, and they can address our members. We can ask them questions. That has great impact for them to see what we're doing. And we bring patients sometimes. They see our patients and they understand because they've all been patients themselves. These members of Congress are also patients, so they understand. If they didn't have a spine problem, their spouse did, their parents did, their kids do, so they understand it, peripherally in that way. We also, because we only have 10,000 members, and because all the other groups give so much money to advocate, we have to amplify our voice and be more powerful. And we do that by forming coalitions with other medical societies besides spine care. Because a lot of things for spine care are also mutually interested by other groups. For example, urologists, ear, nose, and throat physicians, cardiologists, neurosurgeons, other groups across the country, orthopedic surgeons, even primary care physicians, everybody mostly have the same interest in our patients. So we form coalitions together and advocate together. We have more strength that way. So we do a lot of that. That's very important to have coalitions to advocate together. And by doing this, this is how we succeed. And we've been very successful in the United States. We've been able to cause change to occur in the Congress that help our patients with spine care.
Thank you, Phil. That was a great presentation, and I think everybody learned a lot from that. So next we're going to hear from the experts at Policy Wisdom. Ana Rita Gonzalez is the president of Policy Wisdom. She's got 30 years of global expertise in public health policy. She's got experience with governmental institutions, private sectors. She's been out there shaping policy, developing countrywide healthcare reforms in the United States, Latin America, Europe, Africa, Asia, and the Middle East. She's done it all. Policy Wisdom helps clients to use available evidence to shape policies that impact public health. It's 100% focused on health policy and committed to ensuring that all voices are heard and that public health policies are balanced and truly represent and serve the populations they intend to protect. She's got a Doctor of Science degree in Health Policy and Management from Johns Hopkins University in Maryland. She's done graduate studies in Strategic Health Planning from Cornell University in New York, and she's got a Master's of Health Service Administration in Puerto Rico. Joining Ana Rita will be Stephanie Kundert, and Stephanie manages a multifaceted, award-winning public affairs and advocacy program to improve emergency triage and transportation protocols for stroke patients. And she's done this through legislation and regulation across the United States. So she's going to take stuff from the stroke field and try to apply that to the spine field. She has also executed and managed stakeholder engagement, advocacy, government and media relations efforts for a variety of clients across the medical technology, innovation, biopharmaceutical, and pharmaceutical fields. And she's got a BA in political science and international studies and an MA in journalism from the University of Wisconsin. So pay attention to what Ana Rita and Stephanie have to tell you. I think you're going to learn a lot.
Good morning. I'm so happy to be here talking to you about two subjects that are very close and dear to my heart, advocacy and policy shaping. So to start the conversation, I'm going to talk about advocacy and channels and stakeholders. One without the other doesn't work. So let's start by aligning on what advocacy means. Advocacy means a way of supporting decision makers and stakeholders and relevant audience so we can engage them in taking action or supporting a cause or a policy goal. When we do advocacy, basically we create sustainable access to treatment or to preventive measures. And we can do it in a variety of ways. We can do it by positioning policies that create a solution to a public health problem. We can do it by elevating an issue to a level in which it's not only seen at the country level, but it's seen at the international level to get more traction. And it's also seen not only by decision makers or policy makers, but by payers. Some of you might say, why are you separating payers and policymakers? We're separating them because we have payers that do not see themselves in the role of policymakers, or we have payers in private settings, but the decisions they make are guidelines that really drive policy, so they are policy makers, not the formal ones. And the other thing you do with advocating is communicating in a meaningful way with decision makers. When you know what you want to say, when you have a clear goal, your capacity to ask for action or for support is much more evident and much more powerful. So having said that, to advocate, we can advocate through mostly 7 channels. These 7 channels have different type of intention and different type of what they can accomplish. Advocates, like medical societies, patient advocacy groups, usually work in educating and endorsing certain policies. Thought leaders in policy are individuals that are so well known because they understand how policies have an impact that policymakers use them as advisors. Key opinion leaders are individuals who are in the field of medicine, on a technical field, experts that legitimize a policy position. And the good thing about a medical society is that you have in yourself advocates as an organization, but you have key opinion leaders. So you have 2 ways of approaching advocacy. We also have the global and regional policy makers. These are organizations that are supranational in nature. And when they take a subject and they support that subject or support policies on a given subject, what they do is that they spread the issue to be of relevance to more countries, to more decision makers. Then data generation or evidence is a very important channel. And as I say, is an essential channel. Never make a policymaker endorse something that there's no evidence to validate what they are endorsing. But be aware that although data is essential, it's not sufficient. In 38 years of a career in health policy, I still today have to see a policy that was accomplished just because of good evidence. You really have to have other strategies that help that data becomes to life, become real, and create an impact so the policymaker wants to engage. National trendsetters. That means countries that are leading on a given therapeutic area or on a given issue, and they have adopted policies and show that they're ahead of the curve. These countries become national trendsetters to other countries in the same region or to other countries that they relate with. And this is another way of shaping advocacy. And the last one is the health crisis. When we talk about this channel before COVID, people did not get it, but now everybody gets it. There are some policies that are put in place during a crisis that if they're effective and we know how to advocate for them to become permanent, they can make a big difference. For example, you know that telemedicine has been available for 20 years at least, but because of its use during COVID and the policies that were generated in terms of guidelines or reimbursement for telemedicine, now it is becoming entrenched into the health system in general. So that's why we need to take advantage of health crises of different types to ensure that some policies that are tested through the crisis can remain. This is the slide I call the scary slide. Because if you look at all of these bubbles and names, you say, oh my God, the environment in which I shape policies and the number of stakeholders are too many, this is undoable. But basically, what we want to demonstrate here is that the lighter blue is around the people that have a relevant role in the health systems. The darker blue are people that have an indirect role into the health system. And the words that are outside of those two lines of bubbles are issues that are very relevant and that apply to many organizations. So when your organization wants to work with stakeholders, has to be very smart at selecting with which stakeholders to work, have to understand that policymakers get all of these people under different circumstances asking for things, and that they are faced with competing priorities and with many demands from many stakeholders. So you need to be very keen, very smart, very accurate in what you're asking for and how you demonstrate the value to that decision maker. You also need to understand that before it was only the health ministry or the health department. Today, there are many sectors of government, like ministries of science and technology or departments of innovation, that play a role in health and you might be reaching out to. And that the different channels of influence we spoke will speak more to these decision makers. So if you have a minister of health that is a physician and it's a neurosurgeon, your way of talking to that minister is completely different than if you're in a country in which your minister of health is a political appointee. And I have seen ministers of health whose ministry before that one was Ministry of Sports. So they don't have the knowledge about these specific issues that you want to talk to them, and your conversation with them needs to be completely different. In a little bit, Stephanie is going to talk about communication and how best to do that. So let's insist of these different types of stakeholders that are involved in health policy. So you become a stakeholder when a group you belong to or an organization has a direct or indirect interest on an issue, or that you can benefit or be affected. So a patient advocacy group can benefit for certain health policies, and you as physicians can be affected positively or negatively by a public health policy. So the main stakeholders are the decision makers or policy makers, the influencers, and the key groups. And you say, so what's the difference? Influencers are individuals or organizations that we know the decision makers ask things, that the ear is to them. So those are the individuals that we know influence the decision makers, and they can change based on the decision maker. And key groups are organizations or groups because of the sheer nature of what they do, they have a right to have an opinion, make a demand, or offer a solution to a given issue. It is important to understand that the influencers and the key groups can take different roles. It could be providers, it could be patients, politicians, organizations like hospital, employers, regulators. So it depends. That's why it's so important to understand who are the key stakeholders in the issue that you're trying to address. So what are the key reasons we engage stakeholders in shaping policies? Basically, let's look at point number 8, because that's where it all starts and it all ends. We want to increase the quality and trustworthiness of policy. To do so, there's certain things we have to do to make sure that those policies really address the barriers that exist to care, the limitations that it brings to care, if they ignore the evidence that show which is the best care or the best prevention. So to do so and to engage with those stakeholders, we have to take into consideration certain things. Commonalities and differences. We need to know both. So we can maximize the commonalities, but we can also find ways of downplaying or explaining the differences or the disagreements, if they are barriers or if they're only objections, to make sure that we find in a Venn diagram more areas of commonality. We need to help articulate the values of the broader community. So things, no matter what we say, need to be underlined by values. Is our value solidarity? Is our value equity? What are the things that we're looking for? We need to align recommendations based on needs and expectations. We need to improve the mutual understanding of the different stakeholders. And we need to help, once we have a plan, we have a strategy, we have the buy-in of policymakers, we have to help bring the baby home. So really execute, implement the steps that we're taking or the strategies that we're having to get the policy in place. So as I have been saying, we need to know exactly who will have a role, who are the stakeholders. And to do so, the first thing we need to do is map those stakeholders. And you might say, as many of our clients say, oh, I know who's involved. And when we do a mapping and we review who's writing about this and who has met with policymakers, they say, oh, I didn't know such and such was involved, or I didn't know such and such is not involved anymore. So it's very important as you're getting ready to have a strategy that you map your stakeholders to identify who they are, the role they play, to understand who they influence, what their positions are, and what is the relative relevance with respect to other stakeholders. We do all of that, and then the next thing we need to do is an engagement plan. So it's nice to just walk the halls of Capitol or of the Congress in your country, or it's nice just to go to a cocktail or to a meeting and talk to people, but that not always delivers. It's very important that we have a clear engagement plan, that we know who we're talking to, in which order, with which goal, and with which key messages, so we don't lose opportunities. So what are the questions that we ask ourselves when we're trying to do mapping and engaging? First of all, if you look to the right of the slide, we really want to understand relevance. We want to assess the depth and breadth of their influence, and we want to know which of them are a good conduit to establish the dialogue that we want. So it is important to know who matters, why they matter, and when they matter. So what is their spheres of influence, what are the synergies, and also how or when in the process they're important. So that's very relevant for the mapping component. But when we get to the engagement component, basically we need to understand on a broader issue, what are the sub-issues that are relevant and that these groups are willing to engage in. It's very difficult to ask a patient group to talk about science or a technical issue, in the same way that is very difficult to ask a scientist to talk about the emotional impact on a family of a given disease or death. So it's important to know which issues each type of stakeholder can be influential in. We also need to know how supportive they are. Are they very hot about this, or are they pretty cold? You know, how passionate they are, how much would they be willing to invest in supporting this advocacy effort we're doing, how influential they are. You know, one thing is how they see themselves, another is how you find out through reviewing who are they talking to, what their previous positions have created traction or not with decision makers, and how affected they are. The more affected you are by an issue, the more likely you are to be involved and passionate about that issue. So the value of doing this stakeholder mapping and engagement has to do with understanding those individuals and bringing them where they can add the most value, where they can influence the most, and when you can use their credibility and reputation the best, which is their sphere of comfort. So that is why it's so important to really do the mapping and the engagement of the different influencers or the different channels that you're going to use so you can deliver a good strategy to really advocate. Having said that, let me pass it on to Stephanie to talk about the role of medical societies in advocacy.
Great. Thank you so much, Ana Rita. And again, it's wonderful to be with you all today. And I'm happy to touch on the role of medical societies. So as I'm sure you're all aware, being part of a society yourselves, medical societies are important to supporting advocacy and policy efforts. Essentially, you kind of serve as a community of trusted experts, not only amongst yourselves in terms of the information sharing that you conduct on a near daily basis, but external stakeholders, be they policymakers, journalists, they look to you as the subject matter experts in this particular area when it comes to components such as facilitating the scientific exchange of information, educating, especially those external stakeholders, on the value of data, particularly for policymaking purposes. And then communicating the value of therapies, particularly given you tend to be on the front lines of this in terms of being part of the clinical trials or being part of the studies related to these therapies. And then there's the role of defining and implementing generation of evidence that's then used to inform policy strategies and to support the development of strong value propositions for stakeholders, as well as translating patient-centric insights into clinical and policy developments. And so looking at this in terms of a case study, so I've been very fortunate to be part of a campaign called Get Ahead of Stroke. And this was launched in 2016 by the Society of Neurointerventional Surgery. And what the objective was is to improve EMS triage and transportation protocols for stroke patients. Some of you may be familiar that around that time, endovascular therapy came onto the scene as perhaps the most effective way to treat very severe cases of stroke, those involving what's called a large vessel occlusion or deadly stroke that a couple of decades ago would leave a patient permanently paralyzed or worse. But now it's available at higher level, what are called thrombectomy capable and comprehensive stroke centers. So provided that a patient with a large vessel occlusion is transported to one of these facilities in a timely manner, they can undergo this treatment and have a positive outcome. But the problem was when it first came on the scene was we had outdated policies and regulations. Essentially, the standard protocol back then was for EMS to just take the stroke patient, regardless of how severe the stroke was, to the closest hospital. And too often, the hospital was ill-equipped to treat the particular severe cases of stroke involving a large vessel occlusion. And so through Get Ahead of Stroke, we sought to, of course, first and foremost, educate a broad audience and the specific stakeholders, particularly the EMS community and policymakers, about the fact that the technology has advanced to the point that we have this ability to treat severe stroke patients. And then secondly, the purpose was to drive policy change to ensure that the protocols were aligned with where the medical technology was. And I will say the key to communicating this to policymakers was comparing it to the trauma system. As we all know, EMS takes a critically injured patient to a level 1 trauma center. We said we need to do the same for critical stroke patients. And so since Get Ahead of Stroke launched in 2016, we've been successful in improving triage and transport protocols in over 24 states. And at the national level, we had language included in the national model clinical EMS guidelines. And so really, a very successful effort to improve protocols and ultimately improve patient outcomes. And so with that, I'm happy to turn it back over to Ana Rita to walk us through how to influence public policy.
Thank you, Stephanie. It's so nice to see a case study in which the problem was clearly defined. The solution was also very clearly stated, and then the strategies were strategies that will resonate with the decision maker. So thank you so much for presenting that, Stephanie. So now let's talk about my second favorite subject, which is policy and policy shaping. So let's start by, like we started with advocacy, what is health policy? So we all go from the same place. It's a statement of intended action, a framework that guides decision making, and that it's intended to achieve certain healthcare goals in society. So a policy is something that, when in place, guides our actions and our reactions. So having said that, policies can take several different forms. So it could be the typical understanding of a policy, which is a statute or a law, but it can also be a guideline, a protocol, a regulatory measure, a macro policy like the country's budget, plans like a cancer plan or things like that. And also it can take the form of a judicial decision. And let me explain why. Once a judicial decision is made, that serves as a precedent for the next time something like that happens. So although it's not a policy in the typical way, it is a way of ensuring stability in the reaction to a situation. So what is policy shaping? Is the action of changing or influencing policies, let it be new policies or changes to policies that benefits patient and society in general. And I say this with a lot of intention, because if it's a health policy, we want to benefit individuals and society. And we need to understand that that is sort of the lens that we will share with everyone else about the intention of the policy. If we use that lens and we accomplish having a policy in place, there will be progress towards better health conditions, and there will be eventually an impact. We can only do policy shaping effectively if we understand the evidence, as Stephanie was presenting. If we have a clear understanding of the problem, we have a clear understanding of the potential solutions, and also the impact that those solutions will have in the different stakeholders, in the different audiences. So to do that, we need to do a strategy. We cannot go out there and talk to everyone. We cannot go out there and talk to media and things will change, or talk to policymakers directly and things will change. We need to go into a deliberate process of creating a plan, developing some strategies, and knowing how we're going to implement them. When you have that plan and you start acting on that plan, you're shaping policies. So why is so important to do policy shaping? Because when we shape policies and when we have policies in place, the impact runs deeper and in a more stable manner. So the depth and breadth of the impact of a health intervention is much bigger. Also, there are other reasons why we want policies in place. First of all, because a policy represents a reasonable level of agreement among stakeholders. Even if it's a law and it was voted half plus one, there is a reasonable level of agreement. In other spheres, like if you're working with clinical guidelines for a given disease or condition, or if you're working on a regulatory guidance, there is a reasonable level of agreement between those participating. And this is very important to make that policy be viable. It helped create a framework of how the game will be played. So really, in the same way that we define policy as a framework, when we have the policy in place, people know what to expect, what to do, how to act. It helps contribute to the quality of life of society and its growth. So, for example, the immunization schedules of countries, which is the type of policy, includes immunization for diseases that many years ago were causes of death, and today are totally preventable, or they have been eliminated. So it is important to understand that good policies will help improve society growth and life expectancy and quality of life. And as I had said, create also access to new things. So innovative treatments, innovative prevention tests is so important to understand that many countries are afraid of innovation because it costs, or they are afraid of innovation because as it is, they have competing demands, or they don't know if they have the human resources to adopt the innovation. So by creating policies that move the needle towards innovation, towards covering diseases that were not covered before, we are really helping that society to improve, and we're pushing the boundaries of that ministries of health or that health system to do more and to help and serve more people. As I always say, it's the two sides of the same coin, but it's important to emphasize in all of them. In regards to success factors, it's important to understand that we need to use a mix of channels. As we explained earlier in the presentation, you have different channels and your strategy should consider different channels. So you get the attention of those policymakers, let it be from their emotional side, their social side, financial, economic, whatever side is more relevant on them, you're sure that you are reaching them. Evidence. Evidence is always important. As I said at the beginning, is essential but not sufficient. But make sure that when you ask someone to support an issue, that there is evidence that helps them or proves that their position is the correct position. If you don't have that, and by any chance the person is unable to defend the position, never again will they work with you because they will feel betrayed. So it's important that when you ask someone to support a position, to support a policy, an action plan, that you have good evidence that says that what you're asking them is reasonable, is the right thing to do. Cohesive messaging for all decision makers, no matter where they come from. You might have a minister of health that is a neurosurgeon, or you might have a minister of health that is a career politician. So what happens is that they have different lens with what they will receive information. And Stephanie is going to talk about this, but it's very important to adapt your messages so they understand what you're saying. Government. So there are things that are out of your control, and the type of government that you have is out of your control. But it's important to understand that if you are in an environment that is closer to a dictatorship, your policy shaping efforts will be an uphill battle. You need to be more careful, and you need to define who really can talk to governments. This is important to know because you might be better going for governments, neighboring countries, trendsetter countries, countries that government listen to make sure that the battle is not that hard. And lastly, but very, very important, is before you start any efforts, understand the level of priority that the government gives to the issue or therapeutic area that you're interested in. And by that, what I mean is this a government priority? Is there a plan to address this issue? Maybe not. What can I do? Can I make it into a government priority, or can I make it into the tertiary care part of the system as a priority? So you can find different ways of making it a priority, but if it's in the radar of people, they will be more willing to listen to you, more willing to act, than if it is completely out of the radar. So talking about the roadblocks, as I said, the other side. Don't rely on a single channel. Don't ask people to deliver messages that are out of their area of expertise. And an example here we have, you don't ask a patient group to talk about a very technical issue, or you don't ask an economist to talk about the emotional impact of a disease in a family. People have credibility in their area of expertise, and you should be always very careful about that. Evidence that is contradictory, that is weak, or that is too complex and difficult to understand will not work. As I said, governments that do not prioritize the issue will also be more difficult to listen to you. Another thing is innovation. Innovation is an issue that some governments, every government says they're in favor of innovation, but many governments don't know what they're in favor of within the innovation area. So it's important to understand where they stand, how you can help them to demonstrate innovation as an important legacy for the government to address this. So it's important you understand that before you go in so you don't hit a wall. And the other thing, sometimes you're asking for new medicines, new equipment to perform surgeries, things that are completely new. And not only do they resonate or not with the innovation component, but also with the health technology assessment component. As you know, countries have agencies that revise new products. And if these agencies are driven by cost effectiveness, the way to relate to them is very different than if they look at different type of criteria that talked about the impact. So if there is rigidity on cost effectiveness, you need to create more surround sound, more demand for what you're trying to do than you will usually do, so that they are not fixated in cost effectiveness. So having said that, I am going to pass it to Stephanie to talk about effective communication when doing advocacy and policy shaping. Stephanie?
Great. Thank you so much, Ana Rita. That's a very, very informative walkthrough of policy shaping. And so now that we've covered stakeholder mapping and policy shaping, the final key component to your advocacy strategy is to ensure that you can effectively communicate that policy strategy, that the shaped policy to the appropriate stakeholders. And so that'll be the focus of the final portion of today's workshop. So to start, key question is, why is it important to communicate effectively? So there are a few different reasons. So first and foremost, of course, effective communications ensures that all parties involved are satisfied and they feel accomplished, or at least agree to disagree in a respectful manner. And second, clear messages avoid misunderstanding and reduces the risk of potential conflict as long as everyone is engaged in very clear, concise, effective dialogue. And lastly, when conflict arises, effective communication is key to ensure a very respectful resolution to the situation. And so how to communicate effectively? So there are a variety of different things to think about. First, use an appropriate tone. Don't be too harsh, and just ensure that you speak in a very respectful tone. Be mindful of nonverbal communication, particularly eye contact, and using appropriate hand gestures. Preparation ahead of time, of course, is key. Be very clear and concise to ensure that your messages are coming across and are understood by your audiences, which I'll talk a little bit more in a moment. Assert yourself in a very respectful way. Build emotional intelligence, and especially in the health policy space, this is critical, given so many patient stories and families and how impactful health policy is. So it's important, again, to have that emotional intelligence when engaging with your stakeholders. Manage stress. Similarly, the health policy arena can be very stressful at times, and especially when engaging with stakeholders, you have to be mindful of an ever-changing news environment and crises that could impact your engagement. Engage in practice active listening. And so with that said, every communication should be part of a greater plan with a solid strategy. Of course, that strategy being initiating your objective, the purpose of your advocacy. And so there are key elements to consider before in preparation to engage with the appropriate actors and stakeholders. First and foremost, know your issue, know what your objective is. Second, know the evidence. What are the facts and data to support your objective? Third, know your audience. As Anna Rita alluded to at the beginning, there's a wide universe of a variety of different organizations and stakeholders. So it's important to know who your specific audience segments are that are going to care about this issue, so you can narrow it down and focus only on them. And lastly, know your platform. So know what it is that you're ultimately looking to achieve through the objective. Is it general, information and awareness across the public sphere, or are you looking to effect policy change? And so with that said, preparing well before approaching your stakeholders will contribute to a more successful engagement. And so these are just some key touch points to consider in preparing for that engagement. So first and foremost, of course, is to decide what you want to achieve and why. And then to prepare yourself for the unexpected reduction on the time available to communicate your messages. Again, as I referenced, it's an ever-changing news cycle. There could be a major news that happens just before you're set to engage with your audience. So you have to be mindful and navigate that accordingly. Think of potential tough questions and, of course, how to prepare yourself to respond to them. And then decide the most appropriate approaches to adopt. Is it more appropriate to conduct a one-on-one meeting with your targeted audience, or is a policy forum or a roundtable more appropriate? Rehearse, and again, rehearse and rehearse and rehearse in order to be comfortable with your messages. And know the interests and the positions of the different actors, which I'll talk a little bit more about in a moment. And stay informed and updated. And of course, not just on your particular objective and the topic that you're looking to advocate on, but also how any changes in the broader policy space that could impact audience perception or your objective as well. And then demonstrate the benefits for all the parties involved. And then lastly, show a willingness to help, particularly given that you're the subject matter expert here, and just be willing to, engage in a continued dialogue with your audiences, which I'll talk a little bit more about in a moment. So now that we've gone through the preparation, it's important to remember that a successful engagement doesn't finish with good planning. It also requires a very well-prepared interaction that's going to add value for the stakeholders. So it's important to, come in prepared, but also to really be passionate about this issue, because that's going to resonate with your audience and empower them to want to be involved in the effort with you. So having said that, during the engagement, ensure that you come prepared, even understanding what the dress code is, if it's more appropriate for you to come, dressed in business casual or business professional, or even, wearing your medical uniform. Be on time, of course, and apply effective communication techniques such as making eye contact, engaging in active listening, and just creating a very open and friendly dialogue. Stay on message whenever possible. As we all know, in our day-to-day communications, it's easy to get off topic and go off on a tangent, but it's important that given the limited amount of time that you have with your audience or with a specific stakeholder, that you stay on message as much as possible and continue to redirect the conversation towards your key message. Listen and try to connect your objective with the reality of the audience at the moment. And show interest in the person that you're engaging with beyond your objective. Maybe as part of preparation for the engagement, do a little bit of research on the stakeholders you're meeting with beforehand to get a sense of how this particular objective may impact them. It may have impacted them personally, if they may be coming to the conversation with a personal story to share. And also look for areas of common interest too that could really help make for a good icebreaker as you start the conversation. And then lastly, ensure that you come out of the meeting with concrete next steps to ensure continuity of the engagement. So here's what that looks like in terms of what happens after the engagement. So remember, a successful engagement includes forming a lasting and continuous relationship with the stakeholders, even after you've accomplished the initial outcome through that engagement. So following a meeting, of course, it's important to acknowledge and demonstrate that you appreciate the time that they took to speak with you. So follow up with I personally like the thank you card. So again, just to acknowledge that you very much appreciate the time that they took to speak with you about your objective. And then second, follow up on any promises made or address any questions that may have come up during the meeting, which I should note is perfectly fine, during the course of a meeting and a question comes up, you're not sure how to answer. It's perfectly fine to say, I don't have, let me get back to you on that. I don't have the information with me at this moment. So this is a good opportunity in that follow-up to address those questions that couldn't be answered during the initial conversation. And then finally, keep your relations up to date with fluid, continuous communication. So as additional studies come out following that initial engagement, maybe a medical journal article or a New York Times story relevant to your objective, feel free to follow up with the stakeholder and share that information just as a, hey, following up on our meeting, I thought this article would be of interest to you and here's why. Again, the more points of contact that you have with a stakeholder, the more likely they are to remember you. So now that we've kind of talked through how we're preparing to engage and then engage with stakeholders, I want to kind of pivot to how we're going to communicate to different audience segments. So I think as Anna Rita alluded to at the outset, you can't necessarily communicate the same message to a variety of different stakeholders. Each stakeholder has sort of their own health literacy, if you will, and sort of their own background and perspective coming into the dialogue about your objective. So it's important to develop key messages that are tailored to different audiences and thus ensure more effective communication with these audiences. So just to briefly touch on ways of developing these effective tailored communications, first, you want to align the messages with the objective of the engagement. Have strong arguments and data that support your messages. And I'll get into this a little bit more in a moment, but you definitely need to adapt your messages based on the specific audiences and their roles in the decision-making process, understanding that policymakers are going to react differently to the messages than patients, than fellow providers. And next, contain a differentiator to really get the attention of the stakeholders. For instance, it could be millions of people or millions of patients that are impacted by this problem, or the amount of cost savings if we were to proceed with this objective in terms of implementing a policy solution. And then lastly, have a strategy on how that message is conveyed and recognizing the different decision-making styles of the stakeholders involved, be it, coming from a more social-oriented context or a political lens or an economic lens. So just some things to be mindful of. Now, in terms of what to communicate to each of these audiences, let's say to start out, the primary message is a government regulatory agency has granted approval for breakthrough therapy designed to help treat lung cancer. So the first audience that I'll focus on is the general public, where the objective is to simply inform them. And in doing so, we're going to engage in strong headline generating language like revolutionary, game-changing, innovative. So words that are not only going to capture the attention of the general public, but also the journalists and the editors, you'll need to capture their attention as well in order to get the stories generated and inform the public. But also understanding the health literacy as well of the public. In the United States, for instance, only roughly about 30% of the population has a college degree. So you need to be mindful of those who don't have a college degree and ensuring that you're communicating in a way that they understand the messaging. So here's where we kind of have our core messages, our core secondary messages, that there's an innovative drug now on the fast track to reaching patients who until now didn't have this kind of a treatment option. And that you as a company or organization or a society, you're committed to helping improve those patient outcomes through this particular treatment. The second audience segment encompasses medical societies and your fellow subject matter experts. So of course, a different form of health literacy, if you will. given the education level and the fact that you all, essentially speak the same language. And so here's where we're going to layer in more scientific data and evidence into our core messaging to then engage in dialogue and secure those referrals. And at the same time, secure broader support. You're starting to grow that network of support to help move the broader advocacy initiative. So here's where the secondary messages will kind of layer in the real world evidence and also demonstrating how this treatment is going to substantially improve patient outcomes as demonstrated in the clinical trials. And now the third audience segment, of course, are patient organizations. And so here's where, going back to that core message from the upfront, we'll kind of get back to the fact that it's a groundbreaking therapy to help benefits who previously didn't have access to this type of treatment. But in addition to that, it's also important to communicate to patient organizations the importance of access, because at times it's for them, it's like, okay, that's great, we have this treatment, but can we even access it yet? And so that's where it's important to, win over their support, so then they can in turn communicate to the policymakers, to those gatekeepers, and say, look, if we have access to this treatment under the appropriate government policy, it's going to improve patient outcomes and also help ensure a better quality of life in the process. So again, really making sure you emphasize the benefits, reminding them of how they in turn can be part of the advocacy effort by bringing their unique perspectives to the table. And so the last audience segment, of course, are the policymakers. And so here's where, again, in terms of the secondary messaging, we kind of go back to that core message again of this innovative drug on the fast track toward approval, and what it means for treatment options available now for patients, but now also layering in a few of those additional messages that I just spoke about for the patient organizations and for your fellow members of the medical society. But also understanding that, from a policymaker's perspective, they're also going to want to know, what the ultimate cost savings could be. So going back to the get ahead of stroke example, one thing that we've, certainly incorporated into our messaging to policymakers is that stroke costs the United States about $54 billion a year when you think about the long-term care costs involved when patients don't have the best outcome. Here again, you're making the same argument. What the potential financial savings would be if this treatment, were made available to patients, if access were improved for patients. And then also kind of from more of a social perspective, you want to talk about the expanded life expectancy for patients under this type of treatment, what it could mean for them to continue in the workforce, for instance. And so with that said, this is sort of big picture, what I just covered of how you go from the core message that you communicate to the general public through the media, and then kind of layer on from there your key secondary messages that are adapted to the different audience segments. Again, the medical societies, the patient organizations, and then the policymakers. Again, ensuring that you're adapting and tailoring your message based on the audiences that you're communicating to, but at the same time trying to win over and ultimately support your advocacy efforts. And so now for the last segment of the presentation here, I'll just kind of touch on the difference between barriers and objections that you can encounter in the course of your communication strategy. So barrier, of course, is a situation which could undermine advancing or achieving your specific objective. An objection, of course, would be doubts and positions raised by different audiences. This is where your detractors, your skeptics and critics come in. And now in terms of the types of barriers, we have the internal barriers. That's lack of consistency and alignment on your messaging, leading to miscommunication, and also introducing perspectives that are not appropriate or relevant for the stakeholders that you're trying to target. And then in terms of the external barriers that I'll cover in a moment here, we have the financial barriers, social and cultural barriers, technical barriers, communication barriers. So looking at each of those, So in terms of approaching a financial barrier, again, somebody would look at it as, the treatment being very cost prohibitive. What you want to do, of course, is to present the evidence about the impact of the problem at hand and how the treatment provides a solution that's going to benefit the health system and potentially lead to cost savings in the long run. So invest so much now and realize a much larger cost savings in the long run. And so in terms of specific actions to incorporate into that approach, you search for experts' opinions, refer to case studies and successes from other states, say if we're in the United States, or from other countries, and identify as well if there are other studies or evidence that can really help validate your position. And then in terms of an approach toward mitigating social and cultural barriers, again, you want to demonstrate the impact of a particular problem, how it affects the population, and it impacts the mortality level, and how this treatment can address all of that. Provide visibility into the problem by disseminating information about the subject. And then, of course, the long-term consequences if the problem is not addressed right now, and why your treatment is the best remedy to that problem. And similarly to the financial barriers, actions to take, again, going back to relevant studies, finding statistics to support your position, comparing the priority that the problem is given in other countries, and also identifying studies and evidence to further back up and validate your position. And an approach to technical barriers, especially if there's a lack of infrastructure within the health system to accommodate the treatment, demonstrate the added value of recommended interventions to the health system and how the interventions can be implemented within that health system, how you can improve the infrastructure to accommodate more patients, to accommodate this type of treatment option. And again, as I alluded to with the other two barriers, it's important to find those studies to reinforce and validate the importance of these recommended interventions, and also to provide examples and success stories from other states or other countries. And lastly, in terms of communication barriers, the best approach to take, again, is to demonstrate the value of recommended actions and what the difference that it makes and how it solves the problem. And again, consistently providing data, information, especially as it becomes more updated, making sure that you're educating and informing your stakeholders on a continuous basis. And then for actions, prepare messages that address objections and negative arguments with solid evidence and data. And again, establish that continuous line of communication, again, after the initial engagement, continuous follow-up with your stakeholders, continue to educate them about this topic. And where possible, utilize social media and blogs to continue educating your audiences with relevant content. And so to wrap up, this is just kind of an overview of the do's and the don'ts of effective communication that I briefly touched on. So again, among the do's on the left side, have a clear message and strong points, always stay on message, be consistent in delivering your message, listen actively, maintain eye contact, understand your audience, and always ask questions and provide feedback. And then in terms of important don'ts to remember when it comes to effective communication, and don't use negative body language, don't overshare or complicate your message. Again, always stay on message. Don't depend on technology for communication. Don't be afraid to ask questions, and don't be defensive or offensive or have one-sided conversations or interrupt others. So fairly self-explanatory for a number of these. But with that, I thank you so much for your time today. It's been wonderful to speak with you all, and I'm happy to from here, if there are any questions, please feel free to put them into the chat for our live Q&A that will be starting shortly. Thank you.
Okay, so thank you, Anna-Rita and Stephanie, for that very informative session. I always really like what you guys have said, where, if you've seen one country, you've seen one country. The thing is, the fundamentals remain, so that's good. So again, thank you for all that. And Anna-Rita and Stephanie are standing by for questions. So now it's the moment you've all been waiting for. It's Q&A time. So use the chat function. Please let us know where you're from. That'll just help us with getting you the right answer. And we're ready to go. So let's start with the Q&A. And thanks again for all your participation and your attention today. Well, thanks everyone for your participation, and Stephanie and Anarita, again, thank you for sharing your expertise. I learned a lot. I've been involved in advocacy for 20-something years. I won't say how long, but it was really informative. And I really like how you summarized. I like the, Stephanie, especially the last part about the do's and don'ts, because this is really about effective communication. And having a clear argument is critical. Having evidence to back it up is critical. There are so many stakeholders out there that we have to understand. And Anarita, the one slide with all the bubbles with the light blue and the dark blue. Yeah, I mean, there are so many stakeholders. We've got insurance companies, we've got hospitals, we've got patients, we've got pharma, medical device industry, insurance. There's so many ways that we have to do advocacy. So the other thing is, it's advocating at the policy level with governments is one thing, but you can also take these messages and do advocacy in other ways. So let's say you're dealing with an insurance company who doesn't want to pay for a new tech. These same principles, I think, would still apply. Of course, they're going to be more interested in the financial aspects of things. And so I'd really like to have you guys talk a little bit more about kind of that part of it. So the financial evidence, because there's not always a lot of evidence to say this new technology is going to save money. There's an increase in usage of a new technology, and then it levels up, and then sometimes it dips. But you both probably had to deal with that side of it. Can you talk a little bit more about the financial aspects of it? Because I think when you're talking to a policymaker in general, they want to know how to save money. 80% of the population at some point will have low back pain, right? So it's a lot of people. And we've got lots of different ways to address these things. But so I guess I'm starting the Q&A, really. But if you could talk about that financial argument, that would be helpful.
Perfect. So I can take that one before Stephanie. But definitely, one of the key problems that we have is that within the health sector, we're afraid of asking for more resources. So policymakers end up making decisions based on the financials and not on the appropriateness of the intervention. So one thing we always say is that you need to provide them with the data that shows them the impact, not only short term, that it might be more expensive, but the impact long term, and also the impact related to non-health issues like return to work, quality of life, things like that. So this is extremely important, but also is the fact that we need to make sure that when we talk to policymakers, we give them something that we think their tenureship, those 4 years, those 2 years that they have left as ministers of health or in their position, that they can leave a legacy, that they can show they did something. And sometimes they downplay the financials and they upplay what their legacy would be. But Stephanie, anything else to add?
Yeah, so that's a great summary, Anarita. The only thing I would add too is kind of the importance of showcasing that data within very eye-catching collateral. So with the Get Ahead of Stroke campaign, one of the things that we've done, and of course we work very closely with the neurointerventional surgeons who are studying this, and they came out with a study a couple of years ago that demonstrated for each minute saved in getting a stroke patient to the most appropriate hospital for care, especially if it's a large vessel occlusion where they need to go to the comprehensive stroke center. For each minute saved in transport, there's $1,000 in savings over the course of that patient's lifetime, because it's a reduction in required long-term care costs and rehabilitation costs if there's not the best outcome. So if the patient's able to get that care in a timely fashion and essentially walk out of the hospital the next day because of how effective this treatment is, again, that's going to be a substantial savings over the rest of their life.
Excellent. Yeah. And So the financial arguments are critical when you're talking to policy people. The other thing is, what's I think also really important about this webinar is what we talked about really are fundamental issues. So now I want to talk about country to country, region to region. So Anna Rita, you've been a lot of places and talked about this. So can you talk about really, you know, those fundamentals? Does it really work the same in Asia, Middle East, South America, if you've got those fundamental concepts right?
Okay. So Eric, what you said it before, when you see a country, you see a country. So every country is a little different, and every country is very similar. So there is an overarching intention of doing what is right. There is an overarching intention of improving in health services and universal access. The majority of countries, at least 192 that belong to the UN, had abide by the goal of universal health coverage. The problem lies on where they put their priorities. The problem lies on how they make those decisions. So as I was saying, if you are in a non-democratic environment, your battle is more uphill because nothing is transparent. So there's no clarity on how they make the issues other than political reasons and to stay in the same place. When you come to more democratic societies, you have those that are, I would say there is science-driven societies, economics-driven society, and then socially driven societies. So depending on the government in power, you might find a government that will react very positively to the emotion of something, of the population telling testimonials, of helping people or being there with the people. Others will go for very, very economic issues, as I was saying. All the decisions, all the health technology assessment, every decision is driven by economics, and others by that sort of scientific perspective. Does this make sense? Should this be in place? Who should be benefit from this? But all of those approaches can be definitely solved if you have a very strong strategy. If you do an assessment of how your stakeholder makes decisions and you create a very solid strategy, then your communication, your messaging, who talks to who will be driven by that very strong strategy. And if Stephanie allows me before she goes, Pierre Cote from Canada asked a very interesting question about the difference between lobbying and advocacy. And I think it's very tied to this question that you asked. And thank you, Pierre. But definitely, first of all, lobbying is more of a political action. So it's done mostly in the legislative bodies more than executive bodies. And it is, usually it has a quid pro quo. So I give you something in exchange for something. And it's rarely based on evidence. Sometimes key messages are brought in, but rarely they have evidence. Advocacy, on the other hand, is legal everywhere. Meanwhile, lobbying is not legal everywhere. And in advocacy, basically, is a share of voice. More people that have a right to have a voice in a given issue are talking about that issue. We are seeing over the last, I've been working not 30, but 38 years on this. When I started, patients didn't have a voice, medical societies didn't have a voice. Now we're seeing that they all have a voice and they want to talk more about asking for things, asking for benefits to their patients. They're talking about changing policy because they see policy will have a more permanent solution to problems. So Pierre, there are two ways of advocating. Lobbying is more politically driven, more to the legislative bodies, and less driven by science and data. Advocacy is more pluralistic, more individuals or more groups involved talked about it, contribute to it, and is legal everywhere. Stephanie.
Yes, no, that is a great way to outline it, Anna Rita. The only thing I would add to that is, at Direct Impact, we say that we like to complement a lobbying strategy, and then your lobbyists, they tend to be the more the political experts, if you will. Where in the advocacy space, it's the subject matter experts. So people like you who understand patient care, who understand the science and the data behind what you do in your profession. And so while the lobbyists can kind of be the conduit or the liaison between you and the legislators, they can continue to have the conversations on a day-to-day basis. Because again, in your role, your job is to be there for your patients and to save lives, and not necessarily be engaged on a day-to-day basis with the policymakers. So that's where the lobbyists will come in. That'll kind of be their key role. But then while they're having the conversations directly with the lawmakers, in the advocacy space, we're committed to kind of that surround sound. So both within and outside of the Capitol. So inside the Capitol, the lobbyist is communicating your objective, but outside the Capitol, because of advocacy efforts, they're hearing from constituents, they're hearing from you, they're reading about your efforts within their newspapers or seeing it on their local television channel. So all of that encompasses the advocacy space.
Stephanie, and sometimes we find people asking, why didn't you mention media as one of the channels? Because media is a strategy.
Let it be is.
Social media or regular media, it's a strategy that all channels can use. So it's so important to not confuse, because sometimes say, oh, let's do all this media and we will get it out. No, you need to know who's going to be talking to the media. You could need to know who you want to influence, to identify who needs to be talking and what they should be talking about, and never lose sight of your North Star or of your objective of what you want to reach or accomplish when you're doing a policy shaping and advocacy.
That's exactly right. And to the media point too, I will say and really emphasize the importance of patient voices. So your voices matter too in terms of being the subject matter experts, but from my experience, and I'm sure Anna Rita can speak to this as well, reporters, policymakers, they also want to hear from the patients, like how has this benefited them, if they've undergone this type of treatment.
Definitely. And sometimes the patient provider mix is fantastic, because what the provider, the physician says in a way that is science driven and that connects to them delivering the best care possible, the patient explain it in a more human daily life experience. So that combination is very powerful.
Yeah, let's go to one of the questions we got. Thanks, Renato, for this question. It's something I was thinking of as well. So, spine is really more of a, quality of life issue. It's not like heart disease or diabetes where, the worst outcome or stroke, those are catastrophic injuries or death. So spine doesn't have quite the pull on the heartstrings, because people don't generally die of low back pain. I mean, they could, in some ways, but how do you elevate spine in the minds of the policyholders then, compared to these other more catastrophic, more dire situations?
So it's about quality of life, but it's also about the broader issues of work and economies. So, when you look at maybe the absences from work of someone with back pain, you might have a good reason to support spine health. But also, you don't need only to talk to the ministries of health. You can talk about the ministries of science or the ministries of work, human resources departments. So you can talk to others about this. But also bear in mind that we're talking, and WHO is talking about social determinants of health. So it's not only about the complexity of a disease and if a disease can kill you, but it's also about diseases that affect your life and your role in life. So that, there are behavioral issues that we want people to accomplish to be healthier. So if it was me, I would go and say, first of all, I don't want spine health to be among the country's 10 top priorities. I will never get there. That will be a fight I will lose from day one. But I will say quality of life should be part of those 10 priorities. And within quality of life, I'm sure that back pain will make it to the top 10. So you need to find the right approach so it resonates with the decision makers.
100% agree. And I would just add to that, any kind of data, again, those cost savings, what it could cost over a lifetime if somebody is, affected by back pain, what it means for them to not be part of the workforce or to have to rely on any kind of long-term care. That especially will resonate with policymakers. But, it just kind of start locally, engage some key stakeholders, meet with local, elected officials, try to generate some initial media coverage out of it. And then ultimately you can share that media coverage or replicate your strategy in another locality or congressional district and kind of just, build up this advocacy from the ground up. And eventually more and more people are going to be attuned to the importance of spine health.
Yeah, and within the SPINE20 group, we've talked about the fact that spine problems can be the leading cause of disability in the world. And number two is that when people go on disability, there's often a human rights kind of side to this, where people end up at the poverty level because they can't work. So there's lots of those kind of heartstrings that you could pull at. So there's a question from Sami Alassi about asking about putting advocacy, lobbying, this kind of effort into the curriculum for medical education and residency. Have any of you tried that before? Or if so, has it been successful? What would you advise us to do?
It's been successful. Many countries in the world include in the curriculum of medicine, public health. And within a course in public health, and within public health, they speak about advocacy, they speak about policy, they speak about literacy and health literacy, they speak about other aspects like epidemiology, other aspects that a physician should be aware of in the broader efforts that that physician does through medical societies or other activities. So many countries and many universities include that public health course already. And if in your country and in your university it's not there, what you can do is look for curriculums in other universities and offer to them and say, this will really help us to have physicians that are more engaged into the broader things of public health.
Yes, that is a great summary of that, Ana Rita. And the only thing I would add too, at least in my experience working with the Society of Neurointerventional Surgery, they incorporate that as part of what they provide to their members in the medical society, in addition to residents. So we've done webinars, similar to this, just talking about, what advocacy is and how they can be involved. We also develop toolkits that essentially offer, tips on how to communicate with their legislators, how to communicate with the media, and provide samples of op-eds and letters to the editor if they wanted to proactively submit one to their local newspaper, and then also social media post templates for them to utilize. So really, providing a lot of these resources. But I would also, we've also worked with the government relations teams of different hospitals where the SNIS members practice. And so I would also, encourage you to speak with the government affairs teams at your respective hospital. If there's not, if the hospital doesn't already provide this, maybe it's something, they could look to incorporate in the future and involve their own government relations team.
Yeah, we just have a comment really from one of our SPINE20 leaders, Bambang Darwano, who's in Indonesia, and he basically agrees. He's saying that advocacy to patients is easier because it's the patient's problem can easily be described. Advocacy to government is difficult because most governments aren't aware of spine problems, and it's not like a pandemic or something that causes more mortality. So the next thing I want to get into is the special role of a physician or somebody in the healthcare field. So, there's all kinds of people talking to policymakers or other stakeholders. But can you talk about, the healthcare professional and what they really bring to the table? You touched on it in the talk, but I think it's important to highlight how much credibility our members have and why that's vital to this conversation.
So there's a lot of credibility that physicians bring because they're the ones who provide the care. They're the ones whose licenses are at stake if they make a mistake. And they're the ones that should be allowed to practice the best medicine that they should practice. So they bring a lot to the table. Usually within physicians, you can advocate as individuals, which has less impact. You can advocate as medical societies that will have great impact. And you can advocate as key opinion leaders, individuals that have published a lot on a given subject, that are well known by years on a given subject. They can be positioned to be individuals that governments want to hear from. Let it be in hearings at the legislative level, or let it be in roundtables or meetings. It is very important. But definitely, the credibility of physicians is very, very high. Of course, you have to be very careful. If you are a physician that is always defending a pharmaceutical company, or is in the website of that pharmaceutical company, or has been tied to that sort of interaction, even if it's a transparent interaction, and even if there's nothing wrong with that interaction, that can be used to lower the credibility by someone that doesn't think like the way you think. So it is important to select the right people to do the advocacy, but definitely, the voice of the healthcare provider is so important, because you should not be asked to deliver substandard care.
Absolutely. And the one thing I would add to that too is, the importance of patient examples. So, coming in, you're definitely a credible expert, but what also really tends to resonate with policymakers are those stories. So comparing what happens when the patient did not, get the care that they needed in a timely fashion, because of transport delays or what have you, versus patients who did, have timely access to the treatment, and how much better their outcome was. But it's, crucial to come in with those examples. They really resonate with policymakers.
Yeah, and that's exactly where I was going to go next, is the coalitions that we build. Patients obviously are critical. We have brought patients to events. We work a lot with the American Academy of Orthopedic Surgeons. They bring patients to their events. And so we work with neurosurgeon societies, orthopedic surgeon societies, PM&R societies. Have you seen good examples of kind of what I would call extracurricular coalitions? Because within the medical field, we work together pretty well. It's hard for us to work with an insurance company or, a hospital group, that kind of thing. We're just not really that skilled at making those connections. Have you experienced any success stories in that area?
Sure, I'm happy to jump in first here. So we actually have had success working with hospital associations. I will say when we initially launched the Get Out of Stroke campaign, and we're trying to improve these triage and transfer protocols, focusing on those higher level stroke centers. In some states where we were, the state hospital associations were not, that warm to the idea because of the impact it could have on their members that were not classified or categorized as higher level stroke centers. But I mean, we just, constantly had an open dialogue with them. So similarly to the conversations that we had with policymakers, and going back to what Anna Rita alluded to in her presentation, the importance of that stakeholder mapping, we did prioritize sitting down with the hospital associations and making it clear that we're not talking about every single case of stroke going to these specific hospitals. We're saying it's these very specific severe cases that we're concerned about and want to make sure those particular patients get to the right place. And so that just having that dialogue really improved the relationship, and they've really become supportive in a number of states with our efforts. And if Anna Rita, any examples?
Yeah. I want to add a couple of things. Totally agree with you. We worked many years ago to establish the Partnership for Clear Health Communication to work on health literacy, and we had hospitals and insurance and physicians and nurses and public health and patients, and it was fantastic because it was respectful of the comfort zone of each audience. And we mentioned this in the presentation, as Stephanie and I did in different places, but this is so important. You should never ask people to go outside of their comfort zone because they lose credibility and they don't want to work back with you. But fitting their role and working within their comfort zone, the area of responsibility, the area of expertise is very important. On the other hand, I'm going to tell you a story that it's quite interesting. It has to do with ACIP at CDC that is in charge of reviewing the new vaccines. One of the people at ACIP, we were good friends and we wrote a book together. And she was telling me that the different, they started bringing patients to talk about how their children died from an infectious disease or generated a disability. So every meeting, there were 3 or 4 patient testimonials. And she says, after a few months of, having our monthly meetings with this, while these patients were talking, the ACIP members continued typing and doing their email. So anything that you abuse loses impact. So you should not abuse this type of emotional connections. You should not abuse giving a lot of evidence. So you need to find that right balance in which you talk to all the mindsets, economic, political, science, and emotional, without abusing them, because you want them to remain impactful.
Yeah, and that's one of the other keys. We have a Washington, D.C. office, and that's where Phil Schneider does a lot of his work. Joshua Webster is our Director of Government Relations, helped a lot with this webinar. And we're a permanent fixture there, so they can reach out to us for input. And I think, that permanency is important too. So you can't just be one and done. You've got to maintain that relationship.
Exactly. That's so important because a lot of people appear when they need something and disappear. No, you have to be there even to answer questions that they need, but they don't add value to you, because that's how you build a long-term relationship and credibility.
Yes, absolutely. And that's where Josh's role is critical too, because again, we want your members to be focused on patient care. And as I say with the SNIS members, we want you focused on saving people's lives, doing what you do best in that space. So it's important to have a partner, like NASS, who can, continue to maintain those relationships and continue that dialogue, and then bring in key members when necessary.
Yeah, it looks like we're pretty much out of questions. Do either of you have any last words of wisdom for us, or direct impact, not just policy wisdom?
I can do that. H before beauty. Thank you so much for the invitation, for Renato putting all of us together, and for participating today. It's been a great experience. I think that it is our responsibility to advocate for what we feel is correct. And if we advocate with a very clear North Star, we're going to see much more success than we will see failure. And not only will we see success in what we want to accomplish, but we will be impacting health and public health. And if we do that, we're really great people. Thank you so much, Stephanie. Beauty.
No, thank you, Ana Rita. No, it really has been a pleasure to work with everybody to make this webinar possible. And Ana Rita and I really, really appreciate the opportunity. We've really enjoyed it, every part of it. And yeah, I will say, the piece of guidance I would offer is, not to expect anything to happen overnight. Policy change can take a very long time. It can be a bit frustrating at times, but it's just best to be patient. Continue to share those updated data points,
studies as they come out, maintain those relationships. Because I will say, with Get Ahead of Stroke, again, we launched in 2016. And at the time, I remember some of the doctors did not think we would ever get updated national guidelines, the National Model EMS clinical guidelines. And we were successful in making that happen last year. So it was very much a collaborative effort. So again, just look out for one another, continue information sharing. That's the benefit of being part of a medical society. And ultimately you will be successful.
Yeah, and on that note, SPINE20, we've got organizations from around the world, medical societies from around the world. We kind of all have clued into the fact that we need to work on these things together. So we're in our third year, and this is our first webinar. So thank you for being our inaugural guinea pigs for global education in this area. I could see us needing to repeat this down the road. This video will be available to all of those folks who signed up, I believe, by Monday, end of Monday. And I know there's a QR code for evaluation that is part of this. So once that pops up, please go to that link and give us an evaluation. And again, Renato, thanks for putting us all together. Thanks, William, for all the behind the scenes work, and Mike Ryba. Stephanie and Anna Rita, thank you so much. It's been great. Again, also thanks to Ed Doring, Phil Schneider, Josh Webster, and Kinga Bulgara, anybody who had their hand in this. So I think that wraps it up. Thanks again, guys.